Thank you. So welcome to our Joint Hazards Campaign Thursday Talk Zero COVID event. Last week was International Workers' Memorial Day, and the theme was fighting for the fundamental right to safe and healthy work. A demand across the UK should not be controversial, but as we know, more than 60,000 people die each year in the UK because of work, including in the last year about 8,000 workers because of COVID-19. And throughout the pandemic, workers have been placed at unacceptable risks because employers have not controlled the risks. They've not put in place the mitigation measures to stop infections, and the government have provided inadequate and dangerous guidance that has allowed employers to take the risk of people's lives without an enforcement body prepared to step up and ensure no mitigation measures are in place. And we know and have known for most of the pandemic that COVID is mainly an airborne disease, and that there are many things that could and should have been done to prevent infections, prevent long-term disabilities and prevent deaths. And as the Hazards magazine says, no one's coming to save you. So it's up to us, just as it has been all the way through the pandemic. Without trade union safety reps, mortality rates would have been so much higher. I'm so pleased to introduce our speakers tonight, who are going to address some of these issues. We've got Hilda Palmer from the Hazards Campaign and FACK. We have Tracy Edwards, who's the National Officer for PCS. We have Dr. Rhys Thomas, a consultant anaesthetist. We have, and also Jess Dunn, who's a teacher. And we're really pleased that you can join us tonight. So we're recording it and we'll send out the link to the recording after the event, and hopefully send out the links to the presentations as well, and any other documents that people want to share. And after the speakers, I'll open it up to the forum for questions and answers and general discussion. And don't worry if there's any outstanding questions that we don't cover in the evening, we will endeavour to answer them and send out a response. Towards the end of the evening, we're going to have a short presentation about zero COVID as well. So without further ado, I'd really like to welcome Hilda Palmer to talk to us about how do we achieve good indoor air quality. So over to you, Hilda.
Hello there. I'm just trying to, can you hear me? I'm just trying to start my slideshow. Okay, is that all right? Can everybody see? Okay, fine. Oh, I've just made a pig's ear of that. Right, okay. I want to talk about the fact that clean air at work really should be for life, not just for COVID. It's absolutely essential. And for many, many years, for the 30 odd years that I've been doing this, most workplaces, schools, public spaces, hospitals have had very, very poor air quality and ventilation, causing ill health amongst workers. Poor ventilation and polluted air is making workers ill with obvious things like respiratory infections and irritations, but also far worse ill health, very often not linked to the work air. External work is polluted and everybody accepts that, but external air becomes indoor air. And then once it gets inside, it's actually, pollution is added to it from the work activities, from fabric from the building, from asbestos from some buildings, from the furniture and fittings, from carpets and upholstery, off-gassing of formaldehyde from MDF furniture, flame retardants, and there are cleaning products and personal care products, volatile organic compounds. And then there's obviously pollen and viruses and bacteria and fungi. So we live and work in this toxic soup. And this toxic soup includes carcinogens. It includes chemicals that have their effects in parts per trillion, chemicals that interfere with your hormonal system, possibly causing diabetes and obesity, chemicals that cause reproductive harm and birth defects, chemicals that cause asthma and lung disease and heart disease, and a whole range of other illnesses. There's no cell or organ in the body that cannot be affected by air pollution. We drink about 3 litres of water a day, and we wouldn't drink dirty water if we can possibly avoid it, despite what the government is doing in terms of allowing sewage to be poured into our rivers. But we breathe about 11,000 litres a day. And all the substances that I've just talked about that are in the air are then inhaled into our bodies. And the smallest ones, the particulate matter 2.5s, can be inhaled deep into the lungs, can be absorbed into the bloodstream and carried all around the body. They can get across the blood-brain barrier into the brain and cause dementia and cognitive deficits and depression. They can get across the placenta into the fetus. So COVID has come along on top of that and actually exposed poor air and ventilation, and we need to work on all of this all together. Research also shows that if we can improve ventilation and air quality, if we can cut the CO2 level and the 2.5 particulates matter in the air, we can improve concentration, improve thinking and decision making. Amongst children, we can improve their attainment and test scores, and we can reduce sickness absence from all the other infections, the flus and colds and the hay fever and the asthma. So we need to do all of this as well as working on COVID. I just want to remind everybody, as Janet has said, I think we all know that COVID is an airborne transmission, an airborne transmitted illness. It's still here, it's not over, and we have been virtually abandoned. No one is coming to save us. So what we have to do is to organize to clean up the air. I'm not going to labor this, but there's lots of things we have to do. And one of them is toxic use reduction. And that basically means stop putting toxic substances into the air. That means making links with other campaigns on air pollution and climate change, reducing traffic and the burning of fossil fuels and all that sort of thing to stop those toxic substances getting into the air. And we need to stop putting toxic substances into products like furniture and carpets and clothing, so then those products don't get into our homes and into our workplaces to poison us some more. But mostly, and if you want more information on that, there's a longer reference version of this presentation, which I've posted the Google link to in the chat, and it will tell you all about our trade union clean air network. But today, we're really going to talk very much about the role of ventilation, the use of CO2 monitors, the role of filtration and ultraviolet germicidal irradiation. Oh, that's not moving. Why is it not moving? All right. Okay, and that's just to remind us that I hope what we all know is that COVID is spread in small aerosols, which can float like smoke in the air, linger there for hours in poorly ventilated spaces. You can be infected when you're very close to by that dense cloud, but then that will disperse through the air and can infect anybody anywhere. And so even if you have good ventilation, air filtration, you'll still need to wear good masks everywhere in that space. And there is no one silver bullet. Employers have got to implement multiple control measures in order to reduce the risk of the infected aerosols getting into the air and to reduce the chance of them actually being inhaled by somebody. Okay, so what sort of ventilation standards are we looking for to reduce the risk of inhaling COVID and to improve the air quality generally? Well, ventilation is just airflow, and it's measured in litres per person per second or cubic meters per person per hour, and also in room air changes per hour, ACH. The HSE Health, Safety and Welfare at Work Regulations guidance specifies 5 to 8 litres per person per second of fresh or purified air. But the Chartered Institute of Building and Service Engineers for COVID recommends that for classrooms and offices, this is now 10 litres per person per air minimum, or 36 cubic meters per person per hour. WHO recommends 6 air changes an hour. Some experts say higher. Basically, the more ventilation, the better, providing it's not too uncomfortable for thermal comfort. And what this means, the more airflow you have, the more air changes per hour, the less time it takes to remove pollutants from the air, to keep removing the COVID containing aerosols that are being breathed out, and thereby reducing the risk. Obviously, the fewer people you have, the more fresh air per person, and the bigger the room, the more air per person. And we can use carbon dioxide as a rough proxy of ventilation. We can use CO2 monitors to make ventilation visible. Employers should be able to measure the ventilation. If you've got heating and ventilation and air conditioning systems, they should know what the ventilation is. When it's just by natural ventilation, windows and doors and holes in the wall, it's a bit more difficult and varies according to the weather, but they should be able to be measuring it. But CO2 monitors like this Aranet 4 are a way of making the ventilation visible. It's a rough proxy for ventilation because as you breathe out carbon dioxide and that builds up, that gives you an idea of how good the ventilation is. So this is the sort of monitor you should use, a non-dispersive infrared monitor. The Aranet one is very good, and you can download an app on your phone and you can get a readout from that, and that's absolutely excellent. Experts recommend, and what we would say is that if the external air is about 400 to 420 parts per million, then a well-ventilated room shouldn't be more than 600 to 800 parts per million. The HSE agrees, but it wouldn't enforce that. And we would say above that, you should start to take action, open more windows and doors, reduce the number of people in the room and so on, and that above 1500, the room shouldn't be used. And that isn't what the government would say. But why are we saying this? If you look at this graph gives you an indication of how the ventilation rate links up with the carbon dioxide level. So the recommended 10 litres per person per second, if you look at that on the bottom axis, that leads to a CO2 level of about 800 parts per million. If you go to 5 litres per second per person, that goes up to about 1500 parts per million of CO2. And this really matters. Why does it matter? Because at 800 parts per million, that means that only 1% of the air is actually from other people's lungs and therefore potentially infected with COVID. And at 1500 parts per million, there's almost 3% of other people's air. So it's very important that that's what these figures mean. That's why we have chosen those rates, and that's what we are monitoring towards. So ventilation removes the stale air, replaces it with fresher outdoor air, keeps the oxygen level up, removes CO2, removes COVID, hopefully, all the other microbes and some of the pollutants. And it can achieve great dilution and dispersal, but it's not 100%. And as you can see from the diagram on the left, when the ventilation's on, it will be very good at removing the aerosols that are distributed throughout the room. It won't affect very much the big droplets, but those aren't the ones we're so worried about anyway. And it's not necessarily so good at removing that dense cloud of aerosols that are right next to somebody. So it is still very, very important that we stay away from people as much as possible, but you still need to wear a mask in that whole room. Now, ventilation, you may not be able to improve the ventilation enough to get a good removal of COVID. And we know that upgrading ventilation systems takes time and money. They've already wasted 2 years, we know that. But other methods can be put in place to supplement the effect of ventilation. Things like filtration of the air and upper room ultraviolet light irradiation. But we've got to be very much aware of the risks of radiation and chemicals. So filtration can be done by Hepa filtration, high efficiency particulate air filtration, which removes the very small aerosols and all sorts of other particles. And you can put Hepa filters, portable Hepa filters in a room, make sure you've got a suitable capacity. You need to have a clean air delivery rate that provides enough litres per person per second, enough room changes for the room size, the number of people and the activity. And this is something that can be done. You can just plug them in and use them. It doesn't use any chemicals, it just removes the particles, and it doesn't require any expensive retrofitting. There's also ultraviolet radiation, which can be used particularly in the upper room, and that can be really, really effective, equivalent to many, many air changes per hour, but it needs professional installation. It can be dangerous if it's not done properly. And what it will do is to kill off COVID and kill off the pathogens. It won't get rid of any of the other pollutants, whereas HEPA filtration, as well as filtering out the aerosols that contain COVID, it will also filter out a lot of other pollutants which are harming our health. And we would say to avoid ultraviolet light at low levels, because that may be dangerous to the eyes and skin, and avoid adding any extra chemicals. No ozone, no purifiers using plasma or ionizers or ozonators, none of those. Anything that adds chemical to the air can react with other volatile organic chemicals and may actually cause more harm than good. So portable HEPA filtration units, we don't recommend any one particular, but we give you links in our other presentation that shows you where you can go to evaluate the commercial units. We just say that they should have a proper HEPA filter because they're guaranteed to catch over 99.97% of the very 0.3 microns, but it also filters down below that. They must have a, sorry?
Hilda, you've got a couple more minutes.
Thank you. They must have a sufficient clean air delivery rate. They must be quiet enough, and you must check things like the replacement filters and so on. So there's also then a do-it-yourself filter revolution sweeping the world. Dr. Corsi and Jim Rosenthal in America came up with something that could be made using things you could buy in Walmart, filters and fans for about $100, and which would have an absolutely phenomenal clean air delivery rate. And this is sweeping over America. And the World Health Network has spread this. Lots of information is out there. I took this information off the web and actually with my grandson in about 5 or 10 minutes made one of these filters. Took me about a month to order all the components, and it has a phenomenal use. I used a lot of help from Stefan Stojanovic and from Clean Air Crew, and then this has been developed by Rhys Thomas, who's going to talk in a minute. He has taken this to the next level and he has now got an absolutely monster product which he is using in Ceredigion schools, and he's going to talk about that. And then Jess will talk later about the her latest development. She's taken all this information because we have been putting this out through the NEU training and other union training, spreading the information about this, and she will tell you about what she's done. Okay, thanks very much.
Oh, thanks very much, Hilda. That was excellent. And you know, you've done some fantastic work over the pandemic, I know, with the NEU and others in trying to share some of this information. I would just say that, you know, before the pandemic, we were accepting bad air in our workplaces, yes. You know, and it's really important now that we get to grips with it all and to start to change this. And, you know, and some of the other things, the other mitigations in our workplaces still apply, even though we improved the ventilation as well. So our next speaker, I'm really pleased to introduce Dr. Rhys Thomas, is a consultant anaesthetist from Kerry, and he's going to talk about Ceredigion on the Corsi Rosenthal Thomas boxes. Over to you, Rhys.
Yeah, great. Thank you very much indeed for that. That was a lovely introduction there. So yeah, tell me a little bit about my story and our experiences here in Wales and now the UK as well. My background, I'm a consultant anaesthetist by day now, but my background was military. I was trained in biological warfare. I've got an MD, PhD from DSTL Porton Down. So I understand little pathogens very well, which came in very handy actually when it came to the UK Ventilator Challenge. Because I created a CPAP machine, which we effectively won the UK Ventilator Challenge. We were only one of 2 companies that got MHRA approval for devices, and ours was the only new one. The other one was an old design, which was, I believe, 50 years old, actually, and was actually useless. But yeah, we created a device. But the interesting thing about this led us down the route of, you know, understanding that, you know, this is obviously an airborne disease from the start. Actually, SARS-CoV-1 was declared an airborne disease back in 2007. So normally, if you have a virus which comes from the same family, it is automatically given that status. But obviously, for some reason, we don't know why, SARS-CoV-2 wasn't given the same status as SARS-CoV-1 was, but obviously it was an airborne agent from the start. But we created our CPAP device as a biological countermeasure to COVID, and it worked fantastically well. We showed a reduction in ITU admissions by 60% and a reduced mortality by 90%. And this is all from a little device we created here in Wales in a space of about a week. You know, so we had fantastic early success from that. But then obviously things changed then, and really, you know, I was really interested in how we can protect our children, because it's obvious from the politics that nobody else was going to protect them, not even their own parents. So how we were going to get the children to protect themselves was the challenge. Yeah? And going back to first principles again, these are fantastic documents. I recommend everybody reads them. The Lancet COVID-19 Commission on school ventilation and air cleaning, absolutely amazing document by Richard Hammond, and basically shows even before COVID came into existence that if you improve the air, you get 6 weeks of extra schooling a year for every child, which at the end of the day, in 15 years of schooling, that's the difference between probably a C grade and an A grade for a lot of children. Yeah, and that was before COVID, but obviously with COVID lockdowns and being sick with COVID up to 5 times a year, that's a lot of school days missed every year now because of this. And the answer is simple. We manage airborne viruses in biological containment labs very easily, generally very easily, using Hepa and UVC. This is what we need to move to the future now as well, to manage this and try to reduce the amount of school that children miss. But obviously the Joint Union Guide to Improving Ventilation in Schools also got it right as well in September 2021. Their recommendations were fantastic, and they saw themselves that actually this wasn't a pathogen that tended to transmit from the fecal oral route or the hand route, by contact and surfaces. This was primarily an airborne pathogen, and it is still primarily an airborne pathogen. There is no evidence consistently of this pathogen being transmitted from surfaces, even now, with over 3 million deaths of COVID throughout the world. You would have thought there'd be a signal there, but there isn't. But there's thousands and thousands of cases of people catching COVID by just walking into an empty room, which somebody had COVID, would have walked out of it just prior to it. So go figure. So anyway, so what did we do? Well, my objective from the start of this was I read the work from Dr. Cozy and Dr. Rosenthal from America, and I tried to replicate something similar to them in the UK, but we couldn't. Mainly because the fan they use, the box type of fan they use in America is only 110 volts. You cannot get a 240 volt version of it. And also, I thought there was improvements we needed to do to design. Now then, as was previously mentioned, the key figure to be able to get is 6 clean air circulations in an hour. You need to get that. Now, most school classes are approximately between 150 to 250 cubic meters. So you need a device that can actually do about 1,000 cubic meters an hour of clean air to be able to give you safety, to give you that 6 clean air circulations an hour, or even sometimes more, especially if you open the windows and the doors, you're probably up to the 9 clean air circulations, right? But also, I knew from the politics and stuff that we might not be able to get down the route where the government would protect our children by providing professional devices. So again, why don't we get the children to make their own devices, save their own lives? But also by doing this, they learn about the importance of clean air, both indoors and outdoors. And they also get then to build a device in 20 minutes, which then can protect their own lives. And this is effectively what we've done. So we modified the Cozy Rosenthal device and called it the Cozy Rosenthal Thomas device. We've souped it up. It is much more powerful than the American version now. We're over 1,200 cubic liters of clean air now, especially with that device there with the Netta fan. And for the cheaper device, which is 10 or 20 pounds cheaper, this device here does 1,000 cubic meters of clean air an hour. It's absolutely incredible. All for around about £100 once at scale. So experiences we've had, obviously the experiences of getting the device into schools is very difficult, as you're all probably aware of. But we've had 2 very lucky breaks here in Wales, purely from my background, really, because I founded the Wales Air Ambulance Service in Wales a number of years ago. So I had some good contacts in the local authorities, and also I had respect for the previous things I'd done, as well as winning the UK Ventilator Challenge. So I had access to be able to speak to the chief executives, and this is what you need to be able to do, to speak to the chief executives of your local educational authority and get their support then. And then you work through getting it through with management and the business cases and everything else. So two examples of success stories we've had. So obviously with Ceredigion first. Ceredigon's really interesting actually, and the fact is that they understood that the financial implications of trying to get air purifying devices in every room in the school was too much that for any local authority to be able to support. So they were very keen on going down the Cozy Rosenthal route, with them supplying some funding to the schools and then the schools building the devices themselves then. For an example, one school in Ceredigion, they've outfitted the whole school for £4,500, which is quite incredible, really. So, and that's 35 devices they made there for the schools. So every single classroom in that school has got one of these devices in there, which is kids built themselves. Now the other, this is Ceredigion. Now the Carmarthenshire have gone down a slightly different route at the moment. They've gone down the more government directed route, really, which is they're offering professional devices for every school in the county which fails their CO2 tests. So any school which has got an amber or a red, they can apply to the local authority for a Hepa filtration device for that classroom. Now, the trouble is with that, those Hepa devices are about £600 a piece, and they only deliver 200 cubic meters of clean air. So for a school, that barely does one clean air circulation in an hour. So there are some weaknesses in that plan, but we're waiting for the local authorities to get back to work again after the local elections today. And I've got a meeting with them, and we think they're probably going to go down the Cozy Rosenthal route in the very near future, purely from the costs point of view. But also we're working on getting the Cozy Rosenthal devices into the school curriculum in Wales. We've got a different curriculum in Wales. Education is devolved in Wales, so it's different here. So this is where we're heading now, is trying to get in the curriculum so that children can build these devices every year, which actually corresponds to how often you need to change the filters anyway. Ceredigion have stipulated 6 months trial period for changing the filters. That almost certainly is too much. From our own testing stuff, 12 months is perfectly fine. And that's probably what's going to be, because we've got far too much filter surface area, really, but we needed that really to be able to drive the flows. But because we've got so much filter area, we've got a lot of capability to be able to keep going for much longer. So a couple of media interviews, really. I'm sure if anybody really wants to see these, but I've shared this presentation. But we've been on the BBC, ITV, and all the other channels really as well about our device. I'll just give you a quick run through of that.
Made from a high-powered fan and some special filters, with a little help from Dr. Rhys, a consultant at Glangwili Hospital. He's already developed a breathing device to help COVID patients, which has been used in Bangladesh.
I saw Dr. Rhys's work online and in the papers doing some air purifiers. So I contacted him and thought it would be a good idea to have him on board to show the pupils how the scientific side of things, with how the virus spreads through the air, and also learning the ways of building a air purifying machine.
Professionally made air purification devices can cost thousands of pounds, but the raw materials for this device cost just over £100. And the inventor says it can have a real impact on air quality in our classrooms.
So we've got a very powerful fan here on top here.
30 units will now be trialled in primary and secondary schools in Ceredigion.
I came up with a device along with colleagues in America to make a simple device, but yet very powerful, which is very cheap, which the children could actually build themselves to help themselves.
Plans to use ozone machines to disinfect classrooms were abandoned by the Welsh Government last year after safety concerns. These homemade air purifiers are very different and use filters to clean the air.
So it takes the clean air in, the dirty air in through you, then it cleans it down you, then it sends the clean air up and out. It is quite easy to make as long as you've got the right equipment. It was really, really fun. I feel really safe, I feel really happy, clean air with all these lockdowns. It's very nice. I feel safe in the classroom.
Ysgol Gymraeg Furness says it's seen fewer cases of the virus since the purifiers were brought into the classrooms.
So, right, okay. So, oh, wow.
Just a couple more minutes, Rhys.
Yeah, I was just trying to get on to the next slide, actually, but it won't let me. So, here we go. All right, no. Okay, so yeah, so there's another video which is showing you how quickly and easy it is to make these devices. You know, I made these with my children. Yeah, they're 6 and 8, and it took us between 20 and 30 minutes to build them. So I think, you know, we've got to be able to offer a number of versions really of doing it, but certainly from a cost to benefit perspective, HEPA filter wins out. But, you know, UVC is incredibly good. You know, the ideal solution would be have a HEPA device and a upper room emitter in every classroom. But I don't know what it'll take to get that. But certainly for myself, I would definitely have an upper room emitter if you can afford it. But these HEPA devices are incredibly good. And the evidence we've got from the schools is that you might have sporadic COVID cases in the school, but we've never had a single cluster of cases in any classroom. And actually, one of the best descriptions we had is one next door school, same classroom, same type of buildings. One school had 45 cases out of 150 of COVID one day, and the other school had 0. Actually, the comment from the council was, we don't need these devices anymore because there's no COVID in the school. But anyway, you can't underestimate stupidity. But yeah, unfortunately for us and for my children, really, and the local schools here, you know, we've been able to dampen down the effect of COVID from these devices because of these devices as well. So, ladies and gentlemen, thank you very much for this. Plugging for the future, really. If has anybody got any questions, I'm more than happy to answer any questions at the end of this. Thank you very much.
That's brilliant. Thank you so much, Rhys. That was really interesting. And, you know, I mean, it's brilliant that the children are doing this, but isn't it awful that we're having to rely on our children to do this, to keep themselves safe in our schools? And, you know, when you look at now, we're going to hear from Tracy, you know, what's happening in other workplaces. So there's a solution. We know what the solution is. We know what we needed to do to protect people. And the reality in lots of our workplaces, not just in schools, but in other workplaces, is anything but preventing infections. You know, we know there's been massive outbreaks. So over to you, Tracy. Thank you.
Cheers, Janet, and thanks for the invite to come along, and fantastic presentations from Hilda and Rhys. Mine's is probably going to kind of be a little bit boring in comparison, but I'll give it a go. I'm the National Health and Safety Officer from the PCS Civil Servants Union. So obviously we represent people who work in government departments. We've got a few on the call here tonight, such as the Department for Work and Pensions, HMRC, etc., etc. We've also got a number of arm's length bodies and agencies, and as well as outsourced parts of the civil service, such as facilities management and cleaning. And we also represent members who work in national museums and galleries, and that represents over about 200 different employers that we bargain for in the PCS union, and obviously as well there's a kind of quite different workplaces, quite a mixture there. But the glaring problem really, as far as we can see it in PCS, is that we have a civil service, the Crown effectively, that could actually take ownership of this, and one of the things that PCS has been arguing all along is for national standards on health and safety. But the reality has been that it really does depend on where you work, and it depends on if you have a well-organised union in that workplace, because all employers are handling health and safety differently. They've got a different approach. Some of them don't know what they're doing. It's questionable about if there is a competent person in that workplace all along. And I think that the question of ventilation really has really brought that into the forefront in terms of, you know, they need to have a consistent approach. So we've had members during the pandemic who've been, you know, had to be in the office all along and battling with management to get safety mitigations in place. We have had a number of members who've been working from home, but now we're seeing a push for more civil servants to get off their pelotons and to get back into the office. And what we're also seeing as well is that because we know more about the role of airborne transmission, because we know so much more about ventilation, I would say in a major part thanks to the hazards campaign and the trade union movement, members are a bit more informed now, and it's creating actually a lot of anxiety and stress amongst our members if they're being told to return into an office and it's not clear about what they've done on ventilation. So we're arguing for national standards, and it's a real interesting mixture, really. You will have heard of the example at the start of the pandemic of the DVLA Swansea and how they dealt with COVID. To some examples of some quite good employers, you know, the DEFRA department, for example, ran very good comprehensive ventilation surveys on a number of those buildings. And you do get managements in between who want to do the right thing, but don't exactly know what that is. So what we're looking at is encouraging the development, first of all, encouraging the development of building-wide health and safety committees, trade union health and safety committees as set out in the safety reps regulations, the brown book, and for, you know, proper consultation rights for safety reps in the workplace. Secondly, as well, we've just signed up to support the Independent Sage employer pledge, which is essentially a simple pledge that asks employers to commit to the following. The first thing is that we pledge to protect our staff, users and customers from COVID-19. The second thing is to assess the physical environment and working practices according to health and safety law, including risk assessments, in order to ensure that they're designed to safeguard against the spread of infection. And then the third thing is that employers should abide by the best public health advice and ensure that all employees who test positive are both asked and given support to self-isolate at home. So that's a really simple pledge that we believe in PCS that trade unions can get behind, not only to provide a framework, and I'll give you an example of how we're using that at the British Museum in a second, but I think it also encapsulates you know, a very simple framework for members to get buy-in, because what we've also seen during the pandemic is, you know, employers trying to throw confusion in the eyes of safety reps, and our safety reps as well also worrying that they might not be technically minded enough, and how do you take on management when they're coming out with, you know, things like we're following CIBSE guidance and all the rest of it. So what we're doing, so in the next week or so, we are looking at writing to the Cabinet Office, i.e. the government. We're going to be using the services of the British Engineering Services Association to propose to the government, essentially, for the civil service, that there's a long-term investment across all the buildings that the civil service manage, which is properly assessed by a ventilation expert, that there's real-time continuous monitoring taking place, and that there's a national agreement with the unions long-term on how we tackle things like air pollution and the sustainability agenda. But this week we wrote to let me see, dig it out. We wrote to the British Museum management off the back of using the Independent Sage pledge. And you can see here that what we did, first of all, and here's the pledge here, it's a very simple, you know, straightforward, you know, it's a very straightforward pledge that everybody can agree with. We held a members meeting at the British Museum, and we asked our members to vote and to agree on this. So we've now written to the British Museum this week, and we're pointing out, you know, that they're a major tourist attraction, that you know, that as a major employer in London, that not only will they be protecting their staff, but they'll also be boosting the visitor confidence experience, because in some of the rooms at the British Museum, we're seeing consistent levels across a whole day of over 1,000 parts per million each day. And if you're obviously working in that room all day, that tells you that there's clearly a ventilation problem and that action needs to be taken. So we've agreed with our members that in order to adopt the independent SAGE pledge, this is the minimum that has to be done in order to the museum to be able to safely say that they sign up. And you can see it's around CO2 monitoring in galleries, and it's around dust. You know, we have a lot of issues around dust in the British Museum. These are some of the other issues that are in relation to, you know, access to FFP2, face masks, and around you know, occupancy levels and testing. But also as well around the, you know, the HR policies as well, around, you know, ensuring that people aren't coming into the workplace and spreading it further. So that's just an example of how we're using it at the British Museum. We're hoping to use the pledge in other workplaces where we can have a conversation with our members, that we're utilising the expertise of organisations such as the British Engineering Services Association, that we're utilising the expertise that academics and scientists via the independent SAGE group have got to offer into a coalition, hopefully, of trade unions that can get behind this. Unison have signed up to it. I believe the UCU union are also writing to employers asking them to sign up to it, and the NASUWT were discussing it at their health and safety committee the other day. And then, you know, the final thing to say as well is that it clearly keeps health and safety on the agenda. It means that we can engage with our reps and continue the discussions and the continued learning around everything that we know, so that we can, as well as deal with the issue of ventilation, we can also link up with our brothers and sisters in the climate movement and tackle that issue as well. So I'll leave it there, Janet, and thanks again for inviting me along.
Oh, that was brilliant, Tracy, and really, really interesting about what's going on at the British Museum. We know that the DVLA, the problem didn't just sit in the DVLA, did it? It went into the communities. And, you know, we know that workers' health is public health, is workers' health. And if we're going to allow COVID to spread in our workplaces, it's going to spread in our communities as well. So it's really important that we get to grips with the infection rates in our communities. And, you know, I think just listening to you talking about workplace, it's really difficult. We've got all different sorts of workplaces out there. You know, we know the absolute awfulness that is happening in schools, but it's happening in lots of different workplaces, including our public transport, in our shops, you know, and this is a way perhaps to put pressure on employers to do the right thing, really, to protect their workers. So interesting to see what you're doing there, Tracy. Thank you very much for that. And it leads us nicely on to our last speaker, which is Jess Dunn, a teacher at Barnet and a NEU member. And she's actually been trying to campaign on getting the DIY box into her schools, you know, to look at how she can do something on ventilation. So Jess, it'd be great. Over to you, please. I don't know if you're on mute.
Hello there, nice to see you all. Yes, I've just posted some links into the chat for you. There's a link there about the presentation, the slides that I'm about to show you, and also a letter to the council that I've written, plus the evidence document that we've compiled, and a sort of generic risk assessment as a starting point for you. So I'm just going to share my screen. How do I share my screen? Here we go. There we are. Hopefully you can all see that. And view slideshow. Here we go. Okay, I hope that's all right for you all. Okay, so I'm a teacher in Barnet. I teach reception. and I am also an NEU rep in Barnet, and I asked my head teacher at my school if we could have HEPA filtration in the school, in my classroom, and my head teacher asked our borough, Barnet, our borough's health and safety team for the council, asked them if that would be allowed for us to have that device, a device, a HEPA filtration device in the classroom. And they said no. I was making a suggestion of a HEPA filter, but I was also strongly making the suggestion that we go with the Corsi Rosenthal boxes that Dr. Thomas was talking about, because I had heard about those through the NEU filtration and ventilation training, which Hilda led, and I wanted to offer those as a solution because they're so much cheaper and more effective than the commercial versions. But I was really shocked that my local council basically just said no to any kind of HEPA filtration because they believed that the ventilation in the borough is already good enough. So they were saying no to filtration full stop, let alone this sort of DIY model. So I then spoke with my colleagues at Barnet NEU, and we had a discussion about how we could try and change Barnet's mind on this. We rather felt that they had heard the phrase DIY and had decided that we were going to be getting out screwdrivers and hacksaws and, you know, go a bit Blue Peter on the whole thing and get ourselves an empty washing up liquid bottle and a toilet roll and just fashion something out of it. So we thought, okay, I think actually you maybe just don't quite understand what is being proposed. So we put together a letter for our council, but also a document which you can see the link to in the chat. We compiled with Hilda, we compiled this document which is background of the Corsi Rosenthal box filters, but also the evidence of their efficacy, the reason that we need them, the reason that ventilation alone is not enough. As Hilda was saying in her presentation, the benefits of clean air are monumental, and actually it's not just, it is at the moment very much about COVID, but it's not just about COVID. It also filters out our pollutants and allergens, and as a teacher, the idea of being able to keep my children awake in the afternoons because there's fresh air and they're breathing clean air, it helps their concentration, their focus, their cognition, their general ability to learn and engage with that process. And as Dr. Rhys was saying, the idea of being able to, you know, gain those extra 6 weeks of learning for each child, that's massive. That's massive, especially when children have lost so much time to learning throughout the pandemic. So the documents that I've posted really are trying to convince our local council, but I'm hoping all local councils across the nation. It would be great to get that kind of spreading, this idea of actually, you know, let's spread filtration faster than COVID. Let's get this happening, because our local councils do have some power and some traction, as we've heard from Dr. Thomas. It's fantastic the work that he's been doing, and I'm keen to get that happening. So I've been working within my borough and trying to convince my school. I made a box filter, which the union kindly paid for, so that we have a model now that we can use. And then we took it to conference. So the NEU, the National Education Union, had a conference in Bournemouth back in April. And so we went to Bournemouth as delegates, as national delegates, but we also took our box filter with us, and we thought, what a great opportunity to get everybody on board and show them what we're talking about, rather than just talking about some kind of DIY filter. Let's show people it's safe, it's sensible, it's practical, it's easy to make. So we wheeled it around with us. This is Spinny. This is the prototype that we made here. It was my first attempt, but it seemed to do the job fairly well. And this is a basic step-by-step guide of how I made it. So if you find these pictures helpful, please share them, use them. I kind of just wanted to emphasize how simple it is. Really, it's very straightforward when you've done a little bit of reading, you've watched Dr. Rhys's videos and, you know, had a look at some of the research. It's, as long as you know what you're doing, you can confidently go ahead with a bit of gaffer tape, some filters, some cardboard, and a floor fan, and off you go. Really, it's a pretty straightforward thing to do, and you feel like you've achieved so much afterwards as well. It's a really good feeling to make something from scratch. It's just a great feeling, and to know that that thing you've made is providing clean air and keeping you and people that you care about safe when nobody else really seems to be that bothered about it, who's got power. It's a brilliant feeling. It really is. It's empowering. So this is me with Spinny at conference. I think the next slide is loading. Are we loading? Here we go. So at conference, we met lots of the key people at the NEU. So this is Kevin Courtney, who's the Joint General Secretary. I also met Mary Bowstead. You've probably seen them in the news if you're reading about education at all. They're the two main players, and they saw Spinny. They now know about the box fan. So I'm trying to get the NEU as a body behind this concept, because I think, yes, we need my local council involved and schools to know about it, but let's get a national education union behind it. And like Tracy was saying, it's great to get unions involved, to get bigger bodies involved. Let's spread this concept faster than COVID. So these are some of the people that we took Spinny to see. There's some wonderful people here that are really heavily involved at the top of the union who now know about this concept and were really impressed with it and really behind it and could see the sense of it and loved that it's a practical, cheap solution, but you can also draw the children in schools at any age, from early years right up to A levels and university level. There is just so much learning that can be differentiated around this device. This is Vicky Blake, who's the UCU president, so we're trying to get the UCU involved as well, and Ian Watkinson, who's involved with the NEU Health and Safety too. I then was invited very kindly by Hilda to bring Spinny along and have a talk at the NEU Health and Safety fringe talk, which reached about 50 people. So that was great. 50 people from all over the UK signed up, you know, and I've sent out information to them. So hopefully we're getting a bit of a, you know, bit of grassroots action happening in different places. And then there was another fringe talk at the conference for climate action as well, because it ties in so much, not just with COVID, but with climate action and the importance of clean air and fighting polluted air for our lung health, for our general health, for our cognition. So this was me, this was us at conference, and it was a great opportunity to sort of share what we're doing, but to share this concept, because this is a concept that's been so popular in America. And thanks to the work of Hilda and Rhys and Stefan, it's been fantastic to start learning about that and to start spreading the word about that and signpost to these other more knowledgeable people that there is something we can independently be doing. We don't have to wait. We don't have to wait to do this. We can order this, we can order the parts, and we can just crack on and make it and keep ourselves safer. So thank you very much for listening and for having me. Thank you to Hilda, to Rhys, thank you to Janet for having me, but thank you also to Stefan, who I know is here, because it's been really inspirational and meaningful. So thank you.
Oh, thank you very much, Jess. That was inspirational, that journey that you've been on, telling us about that and the importance of, I mean, I think, you know, there was a question in this chat about, is this letting the employers off the hook? And I think, you know, it is really, you know, we're letting not in the employers, we're letting the government off the hook, but we're forced into a position, in our schools especially, where nobody else is doing anything, you know, and, you know, what do? Do we get the children to save themselves? You know, we're saying, you know, we are saving ourselves, you know, and that's the position we're in. I think in workplaces, we need to be thinking, how do we put pressure on our employers? You know, there is money in some of our workplaces. So what can they do? What should we do to force them to make sure that they are properly ventilated, that there's proper air filtration, that there's, you know, all sorts of different devices out there? What should we be doing to protect our members and to put pressure on employers to do that? You know, as well as the pledge that Tracy talked about, I've been involved in something called Scores on the Doors, which is about trying to highlight how each room is ventilated, how it is, you know, how it is safe for workers, our children, and we're working with 1 or 2 employers to do that. And you know, these sorts of initiatives are all about putting pressure on people that have the legal responsibility, the legal duty to do something about it. Anyway, let's open it up to some questions and discussion. So is there anybody who want to put their electronic hand up or their hand up, and I'll try and see everybody on the screen. Anybody wants to ask a question or make a comment? Yeah, nobody. Yeah, Joseph.
Yeah, thanks for all those presentations, which were really interesting and inspirational. I just wanted to pick up a point that some people have picked up on in the chat as well, and that's about the unions themselves. You know, I recently attended one of the equalities conferences in London region for Unite, and I wrote to the regional secretary personally and said, you know, I want to ensure that this is a safe conference, and I was given various reassurances that there will be lots of social distancing, that the door at the back would be open, and so on and so forth. But in the event, you know, I did sit near the door, but nobody, including the regional secretary, wore a mask, and there was no filtration device of any sort. Now, there was a policy conference last October in Liverpool, which I didn't attend, but I heard afterwards 2 people died, you know, as a result of attending that conference. And if you saw photos from that conference, nobody was wearing masks and so on and so forth. So, you know, these devices are not that expensive, as we've seen. And, you know, we need, unions are holding conferences, and several people have commented on the NEU conference and some of the people there not seeming to adhere to safety regulation. We need to be pushing the unions themselves, because we're all going to be attending various conferences, be using these devices at the conferences themselves, whether regional or national. And I'd like to ask Hazards, really, what has their experience been of that? Because I know I've been in touch with Janet about this, and you yourself, Janet, attended a TUC conference recently where you had a bad experience. So, you know, we need to call the unions out themselves on this. I mean, while also obviously tackling the employers.
Yeah, I mean, I think you're right. And, that, you know, like we know, COVID's not gone away, you know, and that's the message that we keep shouting about and keep talking about, and that we need to control the risks of infection. And that's, you know, that's in every conference that we go to and every event we go to. If we're going to start opening up our events in person, then we need to make sure that there are precautions in place. I'll bring in Anne and then Paulina. And sorry, I'll bring back Hilda. I'll come back to you and Jess in a bit, if that's okay.
Mine's brief, because I think Paulina will be much more to the point, but it's building on what Joseph just said. I'm very concerned, particularly, you know, being on TUC Disabled Workers Committee, I'm very concerned because we represent many members who are at higher risk. I hate that none of us like CEV, but clinically extra vulnerable. And with there seems to be, there's such a will, people are so desperate to meet again that even if some of our members are desperate to meet again, even if it's not safe for them yet to meet. So if you've got the drive to meet coming from everybody, how are we going to make it safe? And I just wanted to put in, I suppose we have to use clinically extra vulnerable, but most disabled people would prefer you use higher risk. But, you know. Thank you.
I think you're muted, Janet.
It's a good job I was, because I swore then. Yeah, I think you're absolutely right, Anne. There is a group of people who have been excluded or being put at additional risk because of the way that everybody's acting, you know, and that's not acceptable in our minds. You know, we've got to find better ways of working. Paulina, do you want to come back in? Do you want to come in?
Thank you. I come, from long COVID support perspective, and of course, for us, we have people with long COVID who are now coming back into work in completely unsafe circumstances. And I've given presentations to different unions, and certainly in education unions, I've had this question very often. One is, how do they persuade their workplace really to be safe? Again, the question about filters. What do they need to do to persuade schools to install them? And as we've seen from presentations now, there is a lot of reluctance. I myself, again, am facing the same issue that was raised here, that I've been asked to give a presentation to a union conference, but their conference is going to be face-to-face, and I can't see that there are any measures they're taking themselves to make it safe. So I'm still kind of battling with myself. Can I take that risk? And I probably can't. So how can we make it all safer across the board, within workplaces and within the unions?
Yeah, thanks, Paulina. Nice to see you. And and we know how to make it safe. This isn't some secret. It's something that we've said from the beginning of the pandemic. This is how you make workplaces safe, because our workers have worked all the way through the pandemic. Not everybody's been able to work from home, and lots of workers in all different occupations have continued to work, and we know how they should have been made safe. We know that they weren't made safe because lots of workers have died as a result. Joan.
Yeah, just 2 points. Certainly the whole thing of those of us who are at the highest risk, myself included, we've just been ignored and written out of the whole picture, not just by the kind of media and the government, but also, I think, certainly by the unions and the Labour Party. My Labour Party, for example, they've been trying to meet in person for months. And I mean, there is clearly a generational thing as well as an ability thing that goes on. And I can well understand that for a lot of people, and myself included in my younger days, things like political parties are as much part of your social life as they are about your politics. Going to the pub afterwards has always been kind of as much part of getting involved. And I'm sure the people out campaigning today will be kind of doing precisely that. And that's fine, but they need to remember that it's not just about them, and that the rest of us who can't do that aren't kind of suddenly written off. And there's quite a lot of hostility from people when you say it must be hybrid, of even trying to work out how to do that. And there's actually not that much information about how to do that. And I think we need to work out how we ensure that information is there. But I also wanted to pick up the point Janet made about kind of to what extent when we have to do things for ourselves because the government or the union or our employers aren't doing them. And I think it's a balance. And I think there's a level of which, as a socialist, I think getting people to self-organise, and as a trade unionist, is actually really important. So therefore, getting people to organise, to do it themselves in the same way mutual aid sprang up, in a way, is as important as placing demands on the government and the unions and the employers to do it. The two things go hand in hand. And actually, to a certain extent, the more people get involved in doing it themselves, and particularly students and school children, it's part of learning, isn't it? At the same time as demanding that it's provided for them, it is a really good experience, because we certainly learnt that at the beginning of the pandemic with mutual aid. And I must say, I find it interesting. I still get my mutual aid people doing stuff for me, these lovely young people who go out for me. And that is such a good lesson, and it makes their politics will come alive over the years.
Thanks, Joan. That was some really good points there. And you know, we always used to say a measure of our society is how we treat our most vulnerable in society, are young or old or elderly, those most at risk. And at the moment, we're just abandoning a group of people, a lot of our people in society, and that's not acceptable to me. So how do we keep everyone safe? You know, we want better standards for everyone. Just bring Terry and Anne in, and then we'll come back to the speakers, if that's okay.
Thanks, Janet, and thanks so much to the speakers. I just wondered about hospital appointments, because I go to St Thomas's and Chelsea and Westminster, and they're quite often quite small waiting rooms, and I can literally, you know, there's no windows open, there's no mask wearing apart from me, and you know, it's really stressful. And I just wondered just how to broach that, whether the kind of £100 for the fan, making something like that in the department to try and, you know, put pressure on them, and whether Rhys has possibly, or Hilda possibly had any success in anything other than, you know, the kind of the school environment. Thank you.
Yeah, thanks, Terry. I think that's an important point, and we know that there's plenty of research out there that shows about infections in hospitals. So, you know, there's plenty of evidence to support the need to make them safer through filtration, etc. Anne.
I don't want to hijack this meeting, but I put in the chat, the unions are starting to rev up for the June the 18th demo in London, and I'm really worried about it because I was asked, you know, as co-chair of disabled workers, we were asked to, you know, input access suggestions, and I flagged up COVID safety, COVID safety, COVID safety. And in fact, I've talked to other members on the committee, you know, from NEU and other unions, and we all have the worry about that it seems to be only an in-person event, or the only people, you only get to speak if you're there in person. So that already rules out anybody, you know, it's becoming, it's sort of, we need to make sure that the trade union movement is not doing what Jacob Rees-Mogg is wanting to do and have everybody in a foggy office. You know, how are we going to make it safe? And but I put, this is more to, because some of you may be being asked about this and your advice, and can you do everything you can to input, you know, if, I don't know who's, I know the people at the TUC who are sort of looking after the access side, so I can put you in touch with them if there are specific people of you who might be able to help with this, because I'm really worried, because it's going to be broadcast. So if everybody's squashed together, not wearing masks, even if it is outside, how safe is that? And we've all got the, you know, people getting coaches down from Newcastle, Glasgow, you know, whatever. I'm just really worried. So sorry, I don't want to hijack tonight's meeting, which is about indoor air, but it's related, and it's going to be a trade union showpiece. So
absolutely right. You know, and when we've been asked to write a number of risk assessments on different events that have taken place, and we have sent through the risk assessments. And if people are in coaches, you know, as little people as possible is one of them, but proper standard of face masks. And you know, going back to the question about hospitals, we know that in hospitals, workers have still not got FFP3 masks. High risk environments are still not properly controlled. You know, so there is a way of controlling it, but we know that that's not the case. You know, in lots of places, and there's this irresponsible attitude that we just get back to normal, and we just, you know, if we get infected, we get infected, like, you know, and I think that's totally unacceptable. We'll see, Anne. We've got to put pressure where we can put pressure. Right, just come back to Hilda and then Jess.
Okay, just very quickly, I think the business about making the boxes and how does that undermine things, I think this is a form of self-organizing and self-help and do it yourself, and is actually collectivizing a solution that we know about and that we want to get out there. And I think that needs to grow and develop. I don't think it does necessarily undermine things, but I think it's more easily done more easily applies to the school situation because it can be linked with the sort of STEM learning. But I don't think it should be limited to that. And I think trade unions should be thinking about that. Conferences and meetings and those sort of things, I'm afraid, I feel very strongly that our trade union leadership has actually let us down on this quite badly. At the NEU conference, it was very much the actions of grassroots members actually writing in and putting pressure on people and saying, well, what are the safety procedures for COVID? You know, what are you going to put in place to protect everybody, particularly vulnerable people, but absolutely everybody. And on the basis of that, there was a lot of work done to hire HEPA filters for everywhere. But there was not an overall messaging about the need that people had to wear masks and to protect themselves. And I do think that the trade union leadership is actually a bit worn out and fed up with this, wants COVID to be over as much as anybody else. And I think they're undermining our fight against it, because this is not going to go away. And if we don't get on top of this, so many more people are going to die. This multi-system disease is going to hurt so many more, from children to old people. It is going to damage livelihoods and health absolutely permanently, and we're going to be in a terrible state, and we will not be out of this pandemic before the next one comes along if we do not get on top of this. And I think our trade union leadership, actually, we have to put even more pressure on them to do this. We have lots of information there. I hope we've shared that with you today. Everybody will take it away and use it in a different sort of way, but it is about talking to people. Rhys's experience is absolutely brilliant, and the information that he and Stefan and Alan have developed, we can all use. And Jess is telling us about, you know, how she used this by coming to an NEU training session that I wrote and having seen things online and then putting it all together. And that is really what we need to be encouraging and what we're trying to do. And I think that is inspirational. And I hope people have found this very useful. Thanks very much.
Thanks, Hilda. Jess, do you want to come back or something?
I was reading the chat, and I read Noah's comment about a conference that he went to, and I was wondering if it was the NEU conference. It seemed very familiar. Look, I think we're all absolutely astounded by the fact that we've been through 2 years of a pandemic, and yet now we are having to petition anyone for safety. It's ridiculous. Mm-hmm. But it is what it is. That's the situation we're in. It's not right. It's not the situation it should be. I'm furious about it, but we've got to do something about it. And making these filters ourselves is something practical that we can do about it, which makes you feel empowered, which makes you feel productive, which makes you feel like you're somehow in more control of a situation that feels like it's just running away from you. So I would really urge people to get on board with it. I accept what people are saying about employers being let off the hook. I agree. But there's not time. There's not time to petition other people and wait for other people to move. We know that the government stance on this, we know a lot of people are like sheep behind that and are just going to follow that because it's what we all want. We all want this to be over, but it's not all over. And I think that the responsible thing for people like us to do is to protect the people that we care about, to protect people who are a higher risk than us, to protect ourselves, to be responsible and to lead by example. I also agree with what's been said about the trade unions. I know that I'm an NEU rep. I love the NEU in many ways, but I have not been proud of them. And the conference that we went to, my feedback was quite scathing, that they would have someone like Hilda to lead such wonderful training and then not follow it at their own conference when they have this beautiful example to lead by example and to show people how it should be done, how it could be done safely, well, and spread a sensible message about that. But what I will say is that as a result of taking Spinny to conference, as a result of meeting those executives, as a result of having those conversations with my mask on, I think I was probably one of the only people there with a mask on, but As a result of that, the NEU are now getting on board. I've now been invited to join in with the Health and Safety Executive Party. I've been invited to come to the Health and Safety Conference later in the year. I've been published with Barnet NEU. We've been published in the latest NEU magazine and bulletin. They're getting behind it. If you don't know about an idea or a concept, you're not going to get behind it. So I would suggest to anybody, do what you can to get your union behind these box filters, because they work, because they're easy, because they're cheap. It's a solution. If they don't know about them, they can't get behind them. If they do know about them and they're not getting behind them, fight for them, because it's a really good solution. And it's devastating. We should have to fight for that, but it's working with the NEU. So I can only suggest keep going and keep pushing for it. And I'm sorry that we have to.
Thanks very much, Jess. That was excellent. Rhys, do you want to come back on anything before I bring in Tracy and then Smith from Zero COVID?
Yeah, well, I think we need a multi-pronged approach. The science is incredibly strong. Look, UVC has been around since 1903, won a Nobel Prize for Medicine, for goodness sake, in 1903. Hepa filters were designed by the Manhattan Project to filter radioactive particles out of the air. And these are standards that have been used in biological containment labs, for the last 40, 50 years throughout the world, to contain airborne agents. They work really well. And also we know as well from our own experiences that they work really well. Yes, okay, you might have 1 or 2 sporadic cases of COVID coming in from home, but then you don't get that cluster effect in the classroom, So yeah, it'll still be just the one school child that'll have COVID and they'll go home with COVID, but they won't spread it to 30, 40 other children simultaneously, which is what happens everywhere else. So, we've got the answer, but the answer needs to be, it needs to be cheap. I think the children need to be able to make it themselves. That's the best way, but they can then learn about the air and how importance of clean air is, because education at the end of the day is the most important thing. Education, education, education. And we need to educate our MPs, councillors and everybody else about the importance of clean air, and obviously the evidence was there before COVID, but it's even more important about COVID. And if anybody thinks that COVID is going away, learn about the science of the virus and how it's spread and what damage it does to the immune system and how it evades the immune system. There is a reason why we've struggled to create a vaccine for coronaviruses for the last 50 years. And it's because it's very, very good at evading your immune system. There are a number of conditions out there which look jealously across at COVID and to wonder how it does what it does. We still don't understand it completely, but we do know that if it doesn't quite kill you now, it probably will do in the next few years, because it will keep coming back to you and it will keep evading your immune system and will keep inflaming your immune system, giving you long COVID. And at some point it is going to kill you, and that's what the evidence is. And that's what's building towards it. And the young are affected as much as the elderly and everybody else in between. There is nobody protected from this virus. But then we have a simple defense from it, and it's called, it's using HEPA filters and UVC devices, because they are recommended by, United Nations, WHO, EDC. You can think of all the acronyms that are out there. They all recommend these two. Don't go for anything else. That's all you need. The low-cost approach is definitely HEPA, because that's all the end of the day is. It's just a filter and a fan. Okay, it's very, very simple to make. Okay, and a UVC device. End of the day, a UVC device can be just an LED strip light, but which instead of shining light down at you, it shines light across the top of the room. That gives incredible amounts of deep cleaning to your room. And you get equivalents of between 20 and 50 whole air circulations an hour from those devices. And they are very good for school classrooms, because school classrooms tend to be quite tall. So you've got a lot of air above your head, which could be cleaned while you're talking. You combine that with a HEPA filter device, and you've got the ultimate solution, which is effectively what they're using in all the biological containment labs now. Those are the solutions they're using now. But for the schools, the cheap and cheerful way to doing it is just put a HEPA filter, a good, powerful HEPA filter in the corner of one room, and then crack on, and then don't miss any school at all for the next few years.
Thanks,
okay,
Rhys.
thank you very much.
Thanks very much. And you know, we're talking about they talk about living with the virus. We're talking about dying with the virus if we don't do something proper to protect ourselves. Tracy, do you want to say anything? Just add something.
Yeah, just a couple of things. A really interesting discussion. The first thing to say is that I think it is still important to place demands on employers, not just for the sake of it. I think obviously is how we use that to build the union in the workplace and challenge their agenda, because as much as the government would like us to kind of pretend that, or the government would like us to live with it, pretend it's not there, we're all still knowing people who are getting infected by it. One of my friends has just been down with it for 9 days. It's taken her ages to recover from it, and so the opportunities are there, aren't they? We've got a listening ear from members, and potential members around these issues, so as Jess says, let's empower ourselves to sort of take that agenda forward, and I think ventilation definitely keeps health and safety on the agenda, and fight for a better programme and all of this. And the second thing I wanted to say is that it is disappointing that the unions have got different approaches on health and safety. Speaking as a union employee, PCS have been very good in terms of we've got the flexibility about we can work from home, or if we need to be in an office, we can do that as well, and it's there's safety measures in place. I do know that we're talking to the Brighton Centre at the moment about what safety measures they have in place in advance of our conference in May. I'll certainly pass on the comments from this meeting to our national leadership, but I do know that we are looking at it, but again it does highlight something, doesn't it, that there's a different approach. I know colleagues of mine who work in different unions, and they've been told that they have to come into the office for a percentage of the time, and that's a different approach. And it doesn't make sense to me that all the unions have got a different approach on all of these things, and perhaps there needs to be some sort of TUC wide or union wide approach to how events are organised in the future, something like that. I don't know if that's something that the TUC would commission or Hazards could help with, but yeah, thanks very much, and I'll leave it there.
Thanks very much, Tracy. I think it's really well made points there. Joan, I'd like to bring you in just to talk a bit about the Zero COVID campaign, if you don't mind.
Yeah, thank you. Zero COVID is pleased to be kind of sponsoring this meeting, although Janet and Hazards have done all the work for it. But Janet is very much part of Zero COVID as well, and we work together. For those of you who don't know, Zero COVID is very much a grassroots activist campaign. We've got support from a number of major trade unions, both at a local branch level, but also nationally, from the NEU, from ASLEF, from the Bakers Union, from the Socialist Health Association, as well as working with Hazards. Ever since we were set up in November 2020, our aim has been to demand that the government's approach should be one of eliminating community transmission rather than encouraging it, which seems to have been their policy all along, except when the pressure has become so intense that they realise that millions are going to die on that basis. Our policy and our approach is very much to pursue a vaccines plus approach, which combines vaccination and the mitigations we need to protect people. They're tried and tested public health measures, particularly testing and tracing, and isolating and supporting people who are isolating, but also using masks, social distancing and ventilation. All those mitigations have to go together. They are not restrictions, they are mitigations, and they are protections. And I get very annoyed when they keep being called that wearing a mask is somehow a restriction rather than it being something that will protect the person you're sitting next to on the tube. And certainly we, like I'm sure everybody here, totally condemn the government's living with COVID approach, which it's led to 190,000 deaths, and it's going to be in a few weeks, very soon, it will be 200,000. which is a horrendous figure and almost as horrendous. I mean, the WHO today has been saying that they estimate that 15 million people have died globally, and the measure they're using is based on the excess deaths, and they said a number of countries, including the UK, are way above the average of what they should be. And I've seen figures that say, because of living with COVID, 71% of the population have been infected in one way or another. And when we were talking earlier about those who are at risk or can't go to things, there's over 1 million and probably far more than that people with long COVID who will be added to the number. A lot of them will be added to the number of the long-term disabled. And even if they're not added to that, one of the major symptoms is fatigue. So the idea of going on a demonstration, if you have long COVID, is not, not something you're going to want to do. And so therefore, it's not just those people who are at the highest risk of infection, but it's also those people who are now haven't got the ability to do things that they did before, that we have to be taken on board. We're told the figures are going down, but without the testing and without the surveillance, it's really, really difficult to know what's happening. And certainly we believe we all should be campaigning really, really hard, not just for all the mitigation measures, but to return to testing and surveillance. Because without testing and surveillance, you don't know what the situation is. And the government can get away with their policy of hiding their heads in the sand. So thank you very much, everybody. Really interesting. I'll stick a couple of links in the chat of how you can get involved in Zero COVID. We certainly love people to get more involved. And we do regularly have fortnightly campaign calls, which we encourage our supporters to kind of put their views forward. And we obviously also try and involve and set up a number of activities. And if we are doing activities out on the streets, which we really like to get back to, they very much will be hybrid. And we will still kind of have them on Zoom for I think a very long time to come. So thank you very much, everybody. Excellent call.
Thank you very much, Joan. Yeah, and Zero COVID is about the elimination of COVID. That's what we want. You know, so we're campaigning for that, and in any way we can. You know, that's got to be the future. That's got to be where we're going. Otherwise, you know, we're going to have more and more people. I think, as Rhys said, more and more people are reinfected, and more people with more damaging effects from COVID. And you know, at one point, you know, we're all going to be vulnerable at that stage. So thank you very much for joining us tonight. Thanks so much for our speakers, to Hilda, to Jess, to Rhys, to Tracy. It was fascinating and really interesting, and there's a lot of debates to be had still. And get involved with the Zero COVID campaign. If you're a rep, come to Hazards Conference. We are running a hybrid conference this year, where you can take part in it from your homes with a reduced number in person at Kiel, hopefully with all the safety precautions necessary to keep people safe. And that's certainly our view. And as has been said, ventilation, good air quality is not just for COVID. It's forever for all of us. You know, we all deserve that in our workplaces. We all deserve the fundamental right to safe and healthy work. So thank you very much. And
thanks,
we'll hope to see you soon. Bye.
Thanks, Jess, Rhys, Tracy.